Hi, I'm Shirley Acosta and I'm a registered nurse. I work in the operating room as a circulator. I'd like to discuss with you the different people that are involved when a patient is having surgery and the procedures that we do to avoid wrong site surgery. In the operating room, our ultimate responsibility is to protect the patient while they are under anesthesia. In the operating room, we perform what is called a timeout, and that is communicated with everyone in the operating room to determine what procedure is going to be done for that day and at which surgical site. This procedure begins well before the patient is in the operating room. It begins when the surgery is actually scheduled with that surgeon's office calling our facility. Doctor's orders are written. These orders are transcribed to a patient's consent, and when the patient arrives to our facility, the patient reviews the consent with the orders and signs the consent, saying that they are in agreement with the surgery to be performed. The preoperative nurse or holding nurse prepares that patient for surgery and also confirms the surgery site. The nurse in the preoperative area also signs the consent as a witness. All of this is done while the patient is awake and aware, effectively communicating, and before any medications are given. The operating room nurse or circulator confirms as well with the doctor's order and the consent to what procedure is going to be done, verifies the name bracelet with the patient, and has them verbally communicate what is going to be done that day for surgery. There are two organizations, Joint Commission, which is JCAHO, and AORN, Association of Operating Room Nurses, that both provide policies and procedures to help prevent wrong site surgery. The Joint Commission has a universal protocol, and it's for preventing wrong site, wrong procedure, and wrong person surgery. We're going to discuss the major steps that is provided by their protocol. All must be done before the patient enters the operating room. The pre-op verification process, which is what we talked about a little minute ago. The doctor's order should match the consent, should be agreed upon by the patient. Name band should be verified, which is the spelling of the name, whether they are female or male should be confirmed. Date of birth, surgeon's name, and the procedure to be done for the day. The operative site marking is a very important process. It is done in the preoperative area. The surgeon does confirm the operative site before entering the operating room, and the actual words or word marked on the surgical site is yes, Y-E-S. The non-operative site does not get marked. This marking of the operative site is done with a skin marker, a permanent marker that's not easily removed. It should be clearly visible, and it should be as near to the incision site as possible. There are exceptions to the surgical skin marking, and that is single organ cases such as a gallbladder or an appendix, and also teeth are not marked by a surgical skin marker. The physician should have x-rays available to actually document which teeth are going to be excised. Premature infants are not marked with surgical skin markers because their skin is very thin and could be permanently tattooed. Interventional procedures such as a heart catheterization are also not marked at their incision site because it is not predetermined where the actual incision site will be. Sentinel events. JCAHO tracks sentinel events, and I will quote JCAHO. Sentinel events are unexpected occurrences involving death or serious physical or psychological injury. They're tracked in the JCAHO database, and an alarming statistic was revealed that 5 to 8 new cases each month were recently discovered. Wrong site surgery became the most frequently reported sentinel event in the Joint Commission's database. That was pretty alarming. AORN also has a position statement in place. They definitely endorse JCAHO's universal protocol regarding wrong site surgery. AORN has also deemed it the ultimate responsibility of the operating room nurse to protect that patient We are the patient's advocate, and we are to protect that patient while they are under anesthesia, and that of course involves avoidance of wrong site surgery. ARN provides resources on their website, and they sell correct site surgery toolkits. They sell skin markers that actually have the words timeout, additional literature, and of course research articles in place to help operating rooms avoid wrong site surgery and other areas involving the operating room. So just to review, important JACO protocol is the avoidance of wrong site surgery, the preoperative verification, the marking of the surgical skin site, and as well as the timeout in the operating room. The database that JACO records sentinel events is very important, and we will just take this time to review. JACO's website is JCAHO or jointcommission.org, and the Association of Operating Room Nurses is AORN.org. Both websites are very informative, and thank you for your time, and we'll open it up for discussion. Thanks.